The avian influenza is just one more most recent example of this. We've taken a global approach to looking at avian influenza or bird flu. Once again, public sector, private sector, nonprofits, for-profits, all around the world have really joined together to look at one disease to bring us together. It's going to really actually expand beyond one disease. But what we've been able to do in just, it's not even 2 years yet, is really form a strong coalition with thousands of people working around the country, around the world. We're in about 30 countries right now. The color didn't show up, but there should be pink. Once again, mostly working in developing countries, looking for avian influenza. It's training people in their own country. This is Ministry of Agriculture, Ministry of Health, and Ministry of Environment staff. All together, we get them all together out in the field, make them work together to say, if you help each other, you can do a lot more than you can do individually, because none of them have the expertise to work by themselves on a project. So these guys are doing environmental sampling for influenza. Teach them how to work with birds safely, because we have that expertise, how to do a mortality investigation properly, how to get the epidemiology straight on this. All the reports, a lot of the reports you saw a year or two ago on avian influenza, they talked about the dead bird. So an epidemiologist, that would just drive them crazy, because that's the numerator, one dead bird. Well, the epidemiologist said, well, how many live birds were there? You know, was that 1% mortality or 100% mortality? That's important information. Well, if you just have a virologist studying it, they don't care. They're just interested in the virus. But we're wildlife people. We want to know the impact on a population. So we really have to get better information. And that involves doing good surveys, doing good ornithology, just getting bird watchers involved. So in this program now, we have tens of thousands of bird watchers around the world contributing their sightings and observations to the avian influenza world. And it's really been fascinating. This is collecting a sample of a virus. Kelly had mentioned it. This virus actually pulled out of this swan. It was selected by CDC and the World Health Organization to go into human vaccine, the human pandemic vaccine. So we look at wildlife. Another way to see nature and wildlife is the library of life. Why should we protect the library of life? It would be like burning down all the libraries, all the books in the United States. You don't want to destroy your library. You might need that information in the future. You can see wildlife that way too in the environment. There's the whole DNA of every creature around the world is there waiting, and it's worth protecting because we might need it someday for a vaccine or some other use. The bird watchers, this is very low tech. I showed you those satellite collars for the elephants. They cost about $3,500. It's very sexy. A lot of biologists get very excited about the fact they put a satellite collar on an animal. We do it all the time, but for about $1.50, you can put a plastic color band on the bird and then tell all the bird watchers around the world to keep their eyes peeled for it. And we're getting reports now from China, from India, photographs. People are putting them on the website. We saw this bird. This bird was actually tracked in through China and reported by bird watchers. So we can start to understand where birds are moving for a pretty low-tech approach just by involving the public. This was a high-tech approach with a satellite transmitter. That bird went from Mongolia into China, spent a month or two in China where there were avian influenza outbreaks, then went to North Korea for a day and hung out in North Korea for the day. And then went down to South Korea for the rest of the winter, and then flew back to Mongolia. Just a couple of months ago in Indonesia, we've been working with people harvesting wild ducks for food. They need food. This is the wandering whistling duck. So by definition, if the name tips you off, they wander around Southeast Asia. They don't really migrate north and south. There's a lot about bird migration that we're still learning. We're using some of this avian influenza funding to actually learn about bird migration to benefit birds in general. And because people ask us, well, is it dangerous? Are these birds going to fly here and there? And a lot of times we can say, well, we're not really sure because it's not very, very well studied, and we need that. These wandering whistling ducks, people are collecting. They'll catch some alive. They'll put them with their domestic ducks, which are really a source of avian influenza, and then they'll take them to market later. So you have somebody standing in blood. That's how you get avian influenza, contact with an infected bird's blood. And this is going on all the time. So once again, it's an opportunity for education. We kind of sometimes use disease to scare people a little, and we call that the teachable moment. but you have to be there then to actually teach them something. You don't just scare people and leave. So you want to be engaged, and our long-term programs give us that opportunity to work with local people. These birds are now going to market. Those are all wild birds. They shouldn't be, people shouldn't be dependent on them for food. If they want to have a sustainable hunting program, well, that's great. We can help with that. But just to devastate all your wildlife for short-term for food, that previous boat hunting there up in Borneo, that boat has to move on every few years because they wipe out all the wildlife, and then they have to take the boat someplace else and start harvesting elsewhere because they just deplete their resources. It's not sustainable. Where are we? Afghanistan. Training local vets. These women are all veterinarians in Afghanistan. So we're training them, using this opportunity to train them to sample birds, how to work with wildlife carefully, how to collect the samples, so once again they learn how to care for the wildlife in their country. And then we put this all on the web. This is the Global Animal Information Network for Surveillance, or GAINS, or Avian Influenza Network that I mentioned. And we're making all information publicly available as it comes in. These are positive avian influenza samples. This is open to anyone. We don't restrict our work until we publish. I know a lot of, in the university environment, in the academic world, you hold all your information secretly until you can publish it in Nature or Science, because that, you get benefits from that, you get tenure, you get bigger grants. We don't feel like that serves the public good. I don't feel like it's serving the world well. So every bit of information we get is shared with the public immediately. It does mean we don't get to publish in great journals because they reject them if the public knows about the information ahead of time. It's an interesting little untold secret of the academic world. The site, we're just gearing up every day, making up a little, adding bells and whistles, but all the data is in there. You can actually look at migratory flyways now, so we have so much data about birds. It runs on a one laptop per child. Someone sent us this photo. We didn't have a clue about that, but this is the $100 laptop, the one laptop per child. But somebody was playing with our software somewhere in the world and said, you won't believe it, it all runs. And we give it all away for free. So it's open access, free software, just an open system, all the data. And everybody who participates has to sign an agreement that they won't hold their data back, that they'll share it. So far, in just over a year, we're working in about 30 countries. It's a great little model. We've trained over 1,000 people to work with this, to sample wildlife, and we've got over 100 million birds in the system. We're hoping to have about 300 million later this year, and really be a huge database of where birds are around the world. So you can do migration and tracking, and it'll handle any animal, it'll handle any disease. The system doesn't really care. It doesn't discriminate. As Kelly said in the beginning, just to wrap up here, most emerging diseases and most infectious diseases are shared between animals and people. So of the 13, 14, 1,500 known diseases of humans that people talk about 60% of those are shared with animals. About 2/3 of emerging diseases have some kind of wildlife component. So this, as I mentioned before, we can't really think about human health and livestock health without considering wildlife health. So it's really 3 legs to a stool, and if you leave one out, the stool is going to fall over. So we're really pushing hard to make sure we pay attention to the health of wildlife, because the beauty of nature, and then it's in our own personal interest. This is not like a nice thing to do. We have no future if we don't really think about the interaction of the health of us and animals. A lot of people are getting it. We've been working closely with Homeland Security now for biosurveillance integration. The program has a lot of legs. It's really interesting who's come now to the table since we have so much information about diseases around the world. So Homeland Security, we serve as advisors. Academy of Science, Institute of Medicine keeps calling us in as special advisors on that issues of emerging diseases. So it's a lot of payoff for very little investment that we're finding, besides the fact that we're helping governments all around the world take better care of their animals. Google, next week I'll be at. Google's launching a big initiative for global health. They want a wildlife component, so they've asked us to come and help them, give them guidance on their future directions for google.org. They have a program. And it just links back to this, and this is what we call this One World, One Health. Obviously, I think all of you in the room are sophisticated enough to understand it's just one world. We can be anywhere very quickly. And I'd like you to leave with this concept that human health and livestock health and animal health are artificial divisions created by people. There's just really one health.